Huh?
You do a little thing on my nose. You big.
Are you in pain now? I mean, are you in a
Am I
lot
in
of pain right
now?
now?
Not a lot, no. The prescription she picked up was for some more Dilaudid, and I had a few Demerol, 50 milligram Demerol pills left. I've taken 3 of them today, and that has quieted things down pretty much. The pain never goes away, even with the Dilaudid, even with the Demerol. It never gets less than an ache. I took 8 milligrams of Dilaudid in a 4-hour period Thursday. Nothing. It did absolutely nothing. The pain.
Oh, we don't know that because if you were passing
Well,
a kidney
that's true.
stone,
Yeah, we don't know
it wasn't
that.
as bad or pain, so maybe it was.
Maybe it did do something.
We didn't know that's what was happening.
What caused the stone?
Well,
As I said, the assumption is that the cancer or the chemotherapy is indirectly responsible. The chemotherapy, the fact that I have not been able to eat properly, and I was actually afraid to eat there for many, many days, and not drinking enough fluids. It's also responsible for it. Are we on?
Yeah.
I got to put this out now because the nag told me to.
well, it goes right on my nose.
Okay. There, it's out.
How are your parents and friends
How are my parents and friends?
taking your illness at this time? Are you finding them supportive, non-supportive?
Supportive, by and large. Not as much as being said. You know, we're not coming in contact with that many people, for one thing. Although this couple that we visited over the weekend reacted very nicely to it. That's one of the things I think, and I think I said this to someone else, maybe even to you, that I think you really find out not so much who your friends are, but who can be counted on. I saw an ad on TV. One of the, I think it's CBS, is doing something on life-threatening illnesses that, and I think it's cancer specifically, that for the patient to deal with cancer is only 50% of it. The other half is how the people you work with deal with your cancer. So far, the people I work with and our friends have dealt with it very nicely, thank you. There hasn't been any gushiness or any strange reactions to it. They're all being very mature and very intelligent about it. Your friends are doing okay, and people at your work are doing okay, aren't they?
Mm-hmm. Very supportive.
Yeah. I think people just know a lot more about cancer than they did a couple of years ago, even. It's not. It's getting out of that. It's getting away from its taboo status and becoming better known by the public and what it really is. But I'm still surprised that people will say to me or to Janet, or it'll come back to us, how wonderful Ed looked. As though they're really expecting you to look emaciated or crumped over or totally bedridden.
Yes.
Yeah,
Every single person, bar none, that has come over to see us, from family to friends to everybody, I don't know what they expect, but they're all, every single one has made that comment. I just can't, oh, Ed looks so much better than I ever expected. I just can't believe how good he looks. Well, I started thinking about that, what was my image of cancer before this? And I kind of was talking about with my family, where I kind of had that image before, because when I was growing up, I remember one time I went with my mother over to some people's house that were in our church, and he had cancer. That's all she said, and I guess I was maybe in junior high, and she was going to take something to their house, and she went up to the door, and he answered the door. Well, he had cancer of the throat, and I think what had happened, he'd had radiation, and so it was all discolored, and so it was a very visual image of, oh, that's cancer. And it looked awful, of course. Well, you know, if you look at Ed's stomach right now where he had the radiation, it looks awful. And if he ran around, and if that part was visible to everyone, they'd probably think cancer. But what's unfortunate about it, now I understand that's the cure. That was so awful, not the cancer itself. But, anyway.
Yeah, I think the people, the public, let's use that word, I think the public still needs a lot more education on how to deal with people that they may meet through work or social environment, how to deal with people who have cancer. I sense that people would really like to ask me a lot of questions, but they just don't know how to do it. When point of fact is, all you got to do is ask the question. It's not going to embarrass me or make me feel uncomfortable or set me into a fit of depression. And I try to convey that message at every opportunity. If there's something you want to know about cancer, you know, you've got a living, breathing expert here. Let me know what it is. What do you want to know about it? Do you want to know how I feel? Do you want to know where it was? Do you want to know what they did to me? Do you want to know what I feel, what I'm going through? Ask me any question you want to. And there has to, I hope that this kind of a thing that we're doing here, I hope that this will serve some purpose like that, to let the non-cancer people know that it's okay. You know, it's now, and maybe I'm being too general there. Maybe I'm sure that there are some cancer patients who just don't want to talk about it, who want absolutely nothing to do with it. They don't even want to think about it themselves. But you know, if if you know someone well enough, then by all means get into the conversation, talk about it, because talking about it is good therapy for me, the patient. As well as it might be an education and therapy for you, because God only knows when you might be confronted with it yourself or in your own family.
What would you like, people to know about cancer who are these non-cancer people who may someday have cancer themselves or someone close to them? What would you think, being in that experience right now, you would like to say? And then, Janet, I'm going to ask you independently.
There are a lot of things I would like to say. But I think the most important thing is to not give up. A lot of people who have cancer are going to experience pain. They're going to be probed and prodded in many different ways. It might embarrass them. It might make them feel uncomfortable. But it's for their good. I said earlier, sometimes you have to pay the price in pain to secure the cure. Know it, accept it, deal with it, because it's the only way you're going to get better. I think that's the most important thing, is to just stay in there and keep fighting.
The fighting thing is something, so many people are really talking about, is that, there's actually been studies which have shown that the people who fight, who are angry, do better than those who are not. There's studies of heart attack victims, individuals who've had heart attacks, and those who say, this is, my number's up, I've had it, do much worse than those who say, this is not going to get me, I may have another one that gets me, but this is not the one. How can one develop that sense of fight? I mean, where does it come from? I mean, you've talked already about, at times, so when you're in pain, you almost say gosh, I wish it were all over. I mean, how does one get, how do you convey to another person to fight? How do you get them to fight?
I don't know what the answer to that is. I'm tempted. This is my spontaneous reaction is, some people just have a stronger will to live, perhaps, than others. Maybe that's part of the answer. Certainly part of the answer is that you have the support of friends and family. Part of the answer might also be that they do something like this. Talking about it is the best damn therapy that you'll ever get. You keep it in the closet, you're not going to be able to deal with it. You've got to get it out. Seek professional help. Go to a counselor, whatever it takes, but talk about it. And that in itself will probably develop a strength, a will. I think, yeah, that's...
Does religion or anything spiritual play a role
No,
in your
not at
desire
all.
to live?
Not at all. If I were religious, I'd probably say, why is God doing this to me? No, religion has nothing whatsoever. I use my religion in times of need when I'm alone and I want some comfort. But it does nothing to spur me on, to keep me going. And I'm sure that might be different for other people that are very strongly religious. They might use their religion to drive them on. But for me personally, no, it doesn't do anything.
Does your son?
No. That sounds kind of cold right off the top of the head, but my son does not live with me. He's clear across country. And I love him when I talk to him, and when I see him, I absolutely love him, adore him, and everything. But no, he's not providing me any sustenance or any support. I really can't expect it from a 4-year-old child anyway. But I don't like the idea of dying and leaving him behind. But hell, I'm not going to dwell on that. If I'm going to die, I'm going to die. I don't have any control over that. He's provided for. That's all that I can do. He's not old enough to understand. He knows that Daddy is sick, but he's not. He's not able to understand to the extent to which I'm sick. So there's nothing there, either on the plus side or the negative side. He's not giving me any strength, but he's not detracting from it either.
Does Jana play a role?
Very much so. More than I think she realizes. This thing about nagging, I bring it up frequently, and I'll get on her case about it. But if it weren't there, I would not be as well off as I am, and there's no other way to say it. Constantly suggesting that I drink something or eat something or do something, whatever it is, she's always there to, give me that little prod. She'll say, wouldn't it be a good idea to have a glass of apple juice? And I'll say, oh, for crying out loud, leave me alone, but yeah, give me the glass of apple juice. I need it. I'm just that type of person that needs to be pushed a little bit. And thank God she's the type of person that pushes.
Janet, what would you like to tell people for someone who is, you've really known two major tragedies. The end of your first marriage, and your husband drank, didn't he?
Yes.
As I remember. And you've known this. What do you find more difficult to deal with?
Oh, this.
Yeah.
And, you mean of the two?
Yes.
Absolutely this.
In what way?
I'm scared of, it's going to probably die. And I'll lose him altogether. I was kind of actually, my first husband did drink, and he really bottomed out and committed himself. And I remember there were times that I thought, he's going to die. But I don't think I ever really believed it, because support systems told me that probably he wouldn't, he'll get so low he'll finally ask for help, and he won't die. Because I kept thinking there was nowhere else to go. He couldn't get any lower. He's going to die. But also it was a totally different relationship, and that was, there was always the fact that was his fault, and this is not Ed's fault. And this is something happening to him and us that is so unfair. What would I say to people? I don't know.
What should they know about what life is like for you? One of the things people always say, if they only knew, if you came to work one day and, were a bit snappy,
Yeah.
what should they know about what goes on inside your head, what your life is like now?
Boy, I wish they knew. It is so tough. It is so tough integrating a normal life and then this life. Our life is no longer, well, what's normal in our life is not normal in anybody else's life. And going from this into work with people who are living normal lives and don't know, God, it's tough. It's getting easier. I'm surprised, but it is getting easier to adapt. One of the things is I really do appreciate that everyone's been so supportive. But sometimes I need to go, the only way I can get through that day, I've had to drag myself away from him. I don't want to leave him. I never want to leave him. I've dragged myself away from him, and the only way I can get through that day is to try and forget it, and to concentrate on what I'm doing. And people are constantly saying, "How are you doing? How's that?" Sometimes I just want to scream at them, and for a number of reasons. That's a funny thing. People say, when they know you're experiencing something, and they ask you how you're doing. I guess that really gets to me after a while, because they don't really want to know how I'm doing. When you ask someone how they're doing, you want to hear, "Fine, thank you, how are you?" And it gets to the point I get asked so often, "I'm not fine. I'm tired of lying and saying I'm fine. I'm not fine. Things are rotten. Thank you." But I don't want to say that to people, because that's not fair to people. They didn't deserve to hear that. And also, I don't, even if I don't say it that strongly, even if I just say, "Oh, I'm not so good," then they get all concerned that they either want to hear more or it makes them feel uncomfortable in either way. And I guess I'm really tired of people asking me how I am.
Has your work been affected at all by this illness?
No. Not at all. I'm overqualified for my position is why. And thank God. Thank God I'm in a position where I can do in 15 hours a week what someone else would have to take 40 hours. I hope my boss never sees it.
I was just thinking that.
But thank God, no, I have no pressure there, and that's terrific, and I enjoy what I'm doing, and that's all I need right now. Under normal circumstances, what used to be pre-cancer, I needed to be challenged and feel stretching in my work. Now I don't want any of that. I don't need it. I just want to enjoy what I'm doing.
Very well. Here again, I find those people, there again I find the people that deal with cancer patients seem to be a notch above people who deal with pneumonia or orthopedics or something like that. The doctor the doctor who administered the radiation, Dr. Yu, very open, lots of information, willing to share it, compassionate, sensitive. The staff, the technicians were good people.
Do you remember any other people you saw down there besides Dr. Yu?
Dr. Yu, Glicksman, Jeannie. If I saw her, I'd know.
Laura Hilderly?
I'm sorry?
Laura Hilderly, the
No.
chief nurse?
No. The
Tony?
technicians were Jean, I want to say Annette. I don't think that's right, though. No. And the guy who he's left the staff. I would just come in and sit in the waiting room, and when the technicians were ready, they'd take me in for the radiation and then leave. It was just, I wouldn't even undress because it was in such a accessible area. So didn't get to know too many people in that area.
Did you work with Dr. Glicksman at all intimately?
I met, he examined me once, and I've talked to him on a couple of occasions after that, just very brief conversations. Found him to be a very open, gentle man with an apparent strong desire to help, whether it was through radiation or just conversation. Dr. Yu, again, was as sensitive, as perhaps even more sensitive than Glicksman, but not as polished.
What is happening at Roger Williams now? You're getting chemotherapy?
Getting chemo, back on the chemo again, yeah.
On what is your current schedule?
Once a week, I get an injection of 5-FU, and on the 4th day following, I take 4,500 milligrams or grams? Milligrams of hydroxyurea. Hydroxyurea is nothing. It's a piece of cake. I just pop three capsules 3 times a day for a total of 9 capsules, and there's absolutely no side effect from it at all.
Do you get nauseous from the chemotherapy when it's injected?
I'm taking compazine to overcome the 5-FU. The 5-FU is what makes me nauseous. So I take a compazine about an hour before they administer the drug, and then about 2 hours after they've administered the drug. And that takes care of the nausea, but there's just a general, the whole body just goes into a state of metamorphosis almost. I mean, it's just, it feels as though it's going through some weird transition. If I had to imagine what Dr. Jekyll felt like when he was going to Mr. Hyde, that would be it. It's just a really, really strange feeling, the body reacting to this substance. You get very tired, and it's like being overtired. You know, you still want to go, but you just want to fall asleep. Really a strange feeling. You get off your feet a little bit. It's different from patient to patient. Some people have a very bad reaction to the hydroxyurea and no reaction at all to the 5-FU. And in fact, from what I've been told, it is most common for people to have a reaction to the hydroxyurea and not have a reaction to the 5-FU, not just the opposite.
Who are your principal caregivers at Roger Williams?
Bunch of great people. Dr. Wyman is the oncologist. He's the one who is my principal caretaker. But the nurses, Eleanor and Thelma, Kathy and Dottie, just great people. Just absolutely great people. And I think they give so much more of themselves, and it's sincere. It's not cosmetic. They genuinely care about you, and I almost fear for them a little bit, because it's very easy to get wrapped up in somebody's life, particularly a cancer patient, and particularly one who is as open as I am. And that concerns me a little bit, because when I die, there's a couple more people that it's going to affect, and I feel kind of... They've chosen to be there, but I almost wish they didn't give so much of themselves. Not for my sake. I'm grateful for it, but they may experience a little more pain as a result of having gotten to know me and developed an affection for me, as I have for them.
What do they do in particular that makes you feel close to them, or...
They hug me.
They what?
They hug me.
They literally hug you?
Literally.
They touch you?
Touch me. Joke around. comfort me when I hurt, joke with me when I want to joke around, tell me things about themselves. I tell them things about myself and about Janet. There is a definite friendship that is being formed there that I'm grateful for, but I hope that they don't feel any pain.
Is it meaningful to you that they tell you something about themselves as well as vice versa?
Yeah. Yeah, it is. It lets me know they care, for one thing. If they didn't care, they wouldn't open up. You have no business. I have no time for you. I'll take your pulse and your blood pressure and your temperature, and then you go over there and sit in that chair. So by them telling me a little bit about themselves, it tells me that they care. They're willing to share their identity.
And that sharing of identity is important to you. It makes you feel they care.
Yeah, I'm not so sure it's important to me. It's nice. But I could just as easily walk in there and just have my blood pressure taken and I'll go through all that rigmarole without any friendliness. It just makes it nicer. And it makes it more comfortable, and it makes it easier for me to go there. Not that it's necessarily important that it be there. It's just really nice, and it's. I can see some of the other patients sitting there, and I can sense, and perhaps even see, that they feel more comfortable as a result of it. Let's face it, going through treatment ain't exactly a fun thing to do. So whatever you can get by way of comfort and ease is much appreciated. Certainly it's better while you're sitting there getting an IV or just a quick injection. Certainly it's better to be able to talk to someone and joke and laugh and keep your mind off what you're going through. That makes it much easier. But I don't know if it's an essential part of a cure. It's helpful. That's all I can say. Not that it's going to make me get better. It definitely has an effect on my attitude, sure. Makes me up and positive. So it might be some part of the treatment.
What is Dr. Wyman like?
Wyman's good. He's open, he's candid, he's thorough. He's not as warm. Well, he has a formal warmth about him, let me put it that way. He doesn't call me by my first name, and I've told him, instructed him to call me by my first name, and he refuses to. And maybe that's how he puts that line, draws that line between doctor and patient. I don't think he wants to be warm and cuddly and friendly like the nurses. I think he wants to maintain that professional attitude so that he can keep his objectivity keen, and I appreciate that from the doctor. I probably wouldn't be too keen on him if he were soft and warm and cuddly. It's okay for the nurses to be like that, but he's the man in control. He's the one that's going to feel around there and say, whoops, we found something else, or hey, you're cured. And I want, when those kinds of things are said to me, I want to be able to trust that there's no emotion involved there, that he's not guessing, that he just doesn't want to make me feel better, that it's purely objective and based on physical evidence, not wishing and hoping. He's very professional and good. I can't say enough about him. I do like him very much.
Have you seen Dr. Calabrese anymore?
No, just the one time.
Twice.
Twice? Was it twice? Okay. And he's a very soft, cuddly, fuzzy, warm kind of person. But he can afford the luxury because he's not involved with the patient, with me anyway, and with most of his patients on a day-to-day basis. And there again, very candid, very informative, and very open. And that's what cancer patients need. Whether they go back and repeat everything that has been told them during their examination is irrelevant. The point is they got to know, because they've got to make the choice of how they're going to deal with it. If they choose to be a clam, fine, let them be an intelligent clam. But if they want to be a PA system, let them be an articulate PA system. Either way, you need the information. You need to be dealt with openly and candidly. And don't hedge. You know. If you think I'm going to die, tell me you think I'm going to die. I got to know. I got to prepare.
How have you found the caregivers? Janet, is there anything?
That's interesting. There was a period just after the second surgery that I was disturbed by Dr. Wyman and really kind of upset because I felt he wasn't giving us enough information. Well, when we finally got the chance to talk to him, and certain things happened so that there was a delay in getting to talk to him, and that really was just enough time. There were about 3 weeks between when we had last talked to him, when Ed went in for surgery, and then when we saw him again, that enough time to really build some anxiety. And, you know, I felt that I thought he should have come and talked to us, or I don't know.
While I was in the hospital.
While he was
Yeah.
in the hospital, or at least set up something immediately out of the
Yeah.
hospital. Anyway, but he didn't. Well, when we finally got in to talk to him, he understood our anxiety and our real concern, and he really addressed it. And it turns out he has not given us lots of information because he doesn't have it, but at least he took that time right then and there to say, I don't have it. I promise you I will always give you anything I have. And we just needed that. We needed that reassurance. And it just turns out, and he even said, you know, for some people, you know, it might even be easier for someone that we say, you're not going to make it and you have this long. He says, you're somewhere between, you know, would I say you're going to die in 6 months? Probably not. Highly unlikely. But would I say you're cured? Probably not. Highly unlikely. You're somewhere in between. And we don't know where. I don't know where. At least just that honesty, that openness made us feel so much better. I mean, we went out with no more information than we had when we went in. And having him say, you know, it's going to be hard on you. I know that, and it's going to probably, and the anxiety's only going to grow, and it's only going to get harder probably. It's not going to get easier as time wears on, not knowing anything. So at least, him expressing the empathy, the understanding of how we might be feeling, and boy, that helped a lot. And he sat down with me for the first time just about a week ago after, you know, we'd been seeing him for almost 6 months, and asked me was I still working, how was I doing, was it helping to see the counselor, and I really appreciated that. So, the one thing is I've never really, you know, I've been a little disappointed in him a couple of times was all, but I've never been upset with him or held any grudge because I have just all the faith and confidence in him that he's really thorough. I've never once felt any blame, that I wanted to place any blame on any of the caretakers, any of the doctors for not finding out what's wrong, why, and not curing it. Because you know, now talking to people at work when they've had certain illnesses, so many people are always saying, oh, I hate doctors, I just hate them, I have no use for them because of this incident. When they had some kind of pain and the doctors couldn't find out what it was and they went through so many doctors. Well, you know, I sit there and relate what we're going through. And here they're not finding out what's wrong with them, and they're going through all this. Just that, I guess I just feel like at least they're trying. They're trying everything, and for God's sakes, they're only human, and medicine's only gotten so far, and then technology and everything else. And I've never once. Have you felt
No, in fact,
disgust or blame or wanting to place blame or anything? Mm-mm.
sympathy, because I feel they're probably as frustrated as we are.
Yes.
Not being able to say one way or the other what's going to happen. It's got to be very frustrating for them,
Yes.
especially when they have to talk to you. And Wyman says, we don't know. That's got to be frustrating for him.
Mm-hmm.
Yeah.
I've asked you so many things. Is there anything that I didn't ask that you think really would be important to ask you now, to understand what the illness is like, what the impact it is on the two of you, or what the impact of the treatment is on you?
Yeah, there's something I want to comment on, and I'm not quite sure how to get it out. There have been changes in our relationship. Some subtle, some flagrant. We will never, some we may not ever understand or be able to put into words. And we're probably going to experience even more changes. Maybe not changes, but certainly effects. It's inevitable. It's going to happen. And when people find themselves in this kind of a situation, don't put more pressure on yourself than is already there. It takes time for the couple to adjust. It's a very difficult area. It's an unknown area. You don't know what to expect. You don't know what the outcome is going to be. So be patient with yourself, with each other, and try to understand what each other is going through and talk it out. And just prepare yourself for the effects that cancer will have on your relationship. You don't know what they are, but there will be. You will be affected by it. If you can't, you've got to have enough faith and love and trust in each other to work them out together. And sometimes it'll be just so difficult that you'll cry, yell, scream, but do it. Get it done. That's it.
Yeah, and that it's okay. It's okay to get short-tempered with each other, and it's okay to yell, and it's okay to cry. I think, I have been very open to wanting to go to counseling, and it's really helped a lot to have someone say, it's normal what you're feeling and what you're doing, and what's wrong with that? It's okay to be weak sometimes, to just kind of freak out and not react with calm and cool, that it's not expected, and that it does get better, and it gets easier to cope with, and that strength somehow does come from within.
Toward the end of that tape. House.
4 o'clock.
Well, actually, that's a problem. I was thinking, would 6 o'clock work out for you?
Oh, that'd be great.
All right,
That'd be
that's good
wonderful.
then. Okay. Did I give you it?
Yeah.
6 o'clock?
Do you don't mind being here
No,
in the
no.
evening?
No.
Gee.
That's fine.
One of these 80-hour-week people, huh?
125.
No, it's fine. We'll see. I enjoy the evening time to work. It's a good time to work. Okay, well, unless I hear from you, I'll meet you here around. I'm teaching a class. I don't know how long it goes. It's starting at 4. I don't think I'd have any trouble getting back before 6, but just wait here otherwise.
Will we have any problem getting up here? Is it locked?
No, just tell them you're coming to see Dr. Slade.
One elevator on that side, not this side, which is the more handsome side, And one says freight only. If that light is on, then you have to push that button. If it's not on, you can push any button on that end, and then an elevator will come.
Um, it's not, there's something about eye contact, that if you're looking up and listening to somebody who's on your own level, it doesn't match somehow. You can always tell when somebody isn't listening.
I listen to I hang on every word you say.
Ed, why don't you talk a little bit?
Oh.
Say something.
Well, see, for dinner tonight we're having macaroni with spaghetti sauce. Are you going to take care of the fire tonight, or am I going to take care of the fire? Okay, start the fire soon. Yeah, I want to watch
Is this August jettison? I'm sending you this. Huge confidential. I know you don't know anything about it. I keep saying you.
I am not a thief. Yeah. Great.
Well, it's one of those things. What is happening?
It doesn't hurt to do something. You know, to whatever agency or agencies you use, try to read. It's got to be dropped. It can't be. Yeah.
This Saturday? You want to go? I don't want to go. The president's looking.
I'm not too sure I'll give them copies.
I don't have, I don't.
Well, that's-
I don't have to go. You do.
That's the problem. You know, it is,
That's not a decision you can make. I hate it. You know, you could decide on it.
I should call.
yeah, because it's,
He really was trying to get worse. It doesn't happen.
as I wouldn't feel comfortable knowing that as a boss, no,
I feel.
some of us would read material that I had written. They would probably be like, it might even
I think
sort of
like there's market words needed to this thing, this historically what happens.
don't get president.
Depends on there's like sharing.
Yeah.
I just thought it would be fun to switch.
Actually, it isn't.
Try something different. Huh?
It isn't, but that'll be our.
Well, no biggie.
No, man, no.
I mean, we can keep our same,
No, man.
our same things, and we won't have to remix, re-whatever.
No, man.
Little martyr here. God.
One must learn to adapt. To be a chameleon.
It's a great book by Rainy DuBois, Man Adapting.
You read it?
No.
Have you? It's an interesting book.
I'm
It's
still
really.
trying to get into Mishner's latest book, Stars? Space.
Space. Is he in space now?
Read a lot of it.
Yeah.
My gosh.
Yeah, he's doing something. I took, in fact, when I went to the hospital with the kidney stone, I took it in. Did I go in the hospital with the kidney stone? No, when I went in for the tests, I took the book with me with all the intentions of starting to read it. And I didn't even read the flaps on it. So.
Mm-hmm.
And still haven't read the flaps on it.
Well, the books always seem so enormous.
Yeah. And, well, missioners are, you know.
Yes.
Yeah.
My theory is now using a word processor, which is probably going to double them.
No.
Well, I guess we're...
You're ready. I guess the main question I have, we haven't seen each other for a long time. How is treatment going? Janet, you're looking.
It's not going.
What's happened?
No, you tell him. Ask him the question. He's asking you the question. I want you to talk here. I want you to say something. Go ahead. You tell him.
Well, at last 2 weeks ago, Ed's doctor said that he wanted Ed to take some responsibility in the decision-making on his treatment and in his disease, and finally said, do you want to stay on the chemotherapy? And at that point, Ed said he didn't realize he had a choice. And he went ahead and had the treatment that week and said he wanted to give it some thought and decided not to go ahead with it anymore. And Dr. Wyman's not pushing it. The reason being, after the first series of treatment, there really was no conclusive evidence that it was working. And since as of right now, after the last tumor, it was operable, as far as they know right now, he just went through a big series of tests, he's clean. And it would just be strictly for prophylactic purposes. And this particular drug for this particular kind of cancer is not guaranteed on that kind of basis. So if he were having no trouble with the treatment, he'd probably stay on it and no problem at all. He's just really had a bad time with it. And so he went ahead and, like I said, he had it that week and said, let me think about it. Well, he had a terrible time with it that week. Just both emotionally, physically, psychologically, all-encompassing. And actually, it was a good idea that he had it, and I saw how bad that was, because then I was supportive of him too, deciding not to go with it anymore. It's just come down finally to quality of life. And, you know, what would be it would be a treatment for a year, for one thing. And we saw what he was like after 3 months of the first series round of treatment. Really not good at all. And finally thought, okay, so he goes on this treatment for a year, and what if he just barely goes off and it comes back? What was that worth? A whole year of total misery. So we got an extra year on him. But that's... Would you please talk for yourself?
You're doing a fine job.
Is it hard to talk about it? I mean, do you...
No, not at all. Janet hit most of the, gave me most of the information. There were essentially three criteria that I mulled over in reaching my decision. Number one was that I really haven't felt good for the last 18 months. And that gets to be kind of a drag after a while, you know. So I want to feel good. Most specifically, the 5-FU, which is the injection, the drug that is injected once a week. That was what was giving me the greatest problem, and I would. The side effects ranged anywhere from nausea to vomiting to. You know how you feel, how your body feels when you're coming down with a real bad cold?
Yes, malaise, awful.
Yeah, and that's the way I would feel for 24 to 48 hours. And I would, getting up for that once a week, because I would get the 5-FU every week. After a while, it gets very difficult to get yourself prepared to go into a place that you know you're going to get sick. And this last time was the most difficult. When we first started out with the injections, my attitude was, hey, let's go for it. And if this is going to help, I'm all for it, and let's do it. So I was able to deal with it mentally or psychologically. I was able to deal with it much better than I am able to deal with it now, some 6 months later. It would take me 24 hours and I would recover. This last time I got the injection on Wednesday. Thursday and Friday I was flat on my back. Saturday I started to feel a little better, and it wasn't until Sunday that I could actually look at Janet and say, hey, I feel good. That was a 72-hour period, give or take a few hours, 72 hours. And I just can't, I just couldn't see taking it anymore. So that was the second criteria. And the third criteria was something that we discussed with Dr. Wyman today, in that there is no, there are no parameters. They can't say, yes, the drug is being, there's a high probability that the drug is helping you, or they can't say that there's a high probability. They can't even say that there's a good possibility. All they're saying is, it might be helping you. If the caretakers were able to give me some better statistics there, if they were able to say, hey, there's a high probability that the drug is being of benefit to you and for you, I would have stayed on it. But he can't. And in fact, Dr. Wyman said that is why he's not pushing me, because with the kind of cancer that I had, there really is no good drug or combination of drugs that has proven to be effective, either as a prophylactic or as a tool in the cure of cancer. So with those three things in mind, my decision was to stop the cancer. It was kind of the chemotherapy that stopped the cancer.
It'd be nice to stop cancer.
It was kind of interesting when Dr. Wyman let me in on having a choice. I had the set of mind that, up until that point in time, I had the set of mind that I really didn't have a choice, that I
Yes.
had to go through with this.
Yes.
It never dawned on me that I had a choice. Isn't that strange? You know, it's curious. The doctor said, you will go through chemotherapy. And I said, oh, okay, well, I just assumed then that I had to go through chemotherapy.
And you would have gone along with that decision if this had not occurred?
Sure. If he hadn't said, hey, I want you to know that you are in control here, if he hadn't said that to me, I'd still be on the chemotherapy.
Yes, but then talking today, he did indicate he probably would not have said that to him if this were a case where it probably would, the odds are it was really going to do some good. Because he made that very clear today, that because I think the way Ed almost interpreted that is, yeah, that's right, I have a decision. Well, that's, yes, right now. Almost saying, however, you know, if the cancer came back, or if it were if there were a choice with another kind of drug, I wouldn't at all be saying, hey, you have a choice, or don't do it. In fact, he says, I would be putting pressure on you to stay on it, and that's the only reason I'm not at all. He was really clarifying that. So, you know, I think that's important, because I don't think the average person really has that big a choice, and shouldn't. I mean, it shouldn't be left to feel that they are going to make the decisions in their treatment that much.
How did you feel, Janet? Did you feel that the choice should be Ed's alone, or that it should be both of yours?
Well, he asked me when Dr. Wyman first asked him 2 weeks ago. He asked me what I thought, and inside, I was real torn, so I brought it outside, and I just said, it's really hard for me, because naturally, if there's any chance that something's going to buy a little more time, or, preserve you a little bit longer, I want you to do it, but I don't have to live it. I haven't had to go through those treatments. I've had to watch you, and it looks pretty miserable. And it's not fair for me to say what I think you should do, because he did ask, what did I think? However, at that point, I was still, I hope he does it. And so he took that treatment. That was really smart that he took that treatment, because he felt a lot of pressure at that moment. He was going through a lot. He was getting very depressed over trying to make this decision. Then having the treatment, it physically depresses him, and he was kind of emotionally anyway. So he really had probably the worst 2 days after that treatment than he's ever had after treatment. And so it brought me around, watching him so miserable, whether or not he could bear it. He wasn't. I mean, emotionally he wasn't dealing with it, and it just wasn't worth watching him go through that. And so when, I was by Saturday saying, I want you to know, I really understand if you don't want to ever go through this again. I really.
You know, when two people are really close together around something like this, sometimes another person will pick up the symptoms during the course or really feel a lot of conflict. And even though you might not address it as such, either a family will begin to fight and get angry, or one will really go through a lot of stuff in developing physical symptoms themselves, feel torn apart, twisted, wrenched. Did you feel any of that in the past couple weeks?
Sure.
Did you respond in any way, either getting angry or bitchy or feeling yourself getting symptomatic? And
You know, I just think the main thing that's happened in the last, really for us, in the last 6 months, but even in just, I guess this whole last year and a half, when I first started going to see a counselor, I was doing it for me because I was so upset and nervous and torn and everything and depressed. And she was saying, you know, you'll go through changes in your relationship and you will have problems and so, you know. She would say that kind of in passing. And the first couple of times she said something like that, I got inside very defensive, thinking, Ed and I have a perfect relationship. We're not going to go through any problems. I really did.
you're not human beings, huh?
Because I love him supporting me sick. What do you mean? That made it sound like how could we possibly start fighting? No. Well, it happens. It happens. Mainly the passage of time. It wears after a while. You know, if this disease only lasted 6 months tops, we probably wouldn't have had any problems. But after a while, day in and day out, him not feeling well, by seeing him not feeling well, sometimes you get depressed, you get irritable. We've gone through a lot of changes.
Do you ever feel like bailing out? I mean, either of you just like saying, damn it, that's a common feeling, incidentally. I'm not, you know, like out of the marriage, almost like saying, I just want to get away.
We're just real volatile, and we just spew and fight and say you're totally irrational things, and then the other one has to say that was totally irrational. Don't you really want to talk about this? Oh, why don't you leave, go live with your parents? Why don't you leave?
Yes.
Oh, sure. Weekly.
No, that's a common thing. You know, a man told me once who had a heart attack that began to fight, and for the first time in the marriages, and it was a very young man, they were considering divorcing. And he said, when I interviewed him once around, he said, I was going to leave them before they could leave me. And what he meant by leave me meant through death. You know, was that he would just say, you know, I don't want my kids, I'll get out. That he had control, you know, and that somehow, so it's a common thing. It would be expected that the two of you would really feel if you're human beings, which we all are, it's a twisting, and as you say, long time, Janet. It's a long time.
I think I did, the counselor helped me a lot in that. I went through the period where he was in so much pain and surgery and whatever. I thought, I didn't want to watch him die. I didn't want to go through this. I would rather play games with my mind and leave. And that way it ended. I guess that's the same thing. Under my control. He didn't. I wouldn't. In fact, I think it maybe went through my mind. Maybe I would never even have to know if he died.
That's a good thing to say, though, because what you're both dealing with is how you were trying to gain control out of this illness, and which many people say the worst thing about cancer is there's something out of control, and you suddenly are given some control by controlling your therapy, at least. At least you aren't going to have the nausea and vomiting and feeling this intense, almost like dead all over feeling that one has, the malaise. And your way of controlling would be, at least I don't have to see this stuff that's testing me so much that I'm doing things I never expected I would do. And I get angry at a sick person.
Yeah, I never knew when she would get angry. Your first reaction when someone gets angry is to take it personally, I guess. So, but I never knew if she was mad at me, or if she was mad at the disease, or if she was mad at the inconvenience of it all, or the anxiety of it all. Yeah, so it confuses after a while the person. It was confusing me, so that just compounded the thing. in the early stages, Janet was relying on me for certain strengths. And she's come a long way. We both come a long way throughout this whole thing. So that when she would get angry, I couldn't give her the support that I thought she needed, and I would wind up confused, and that would just really muck up the whole thing.
Can the two of you separate out when you're angry at each other, when you're angry at the disease, when you're angry at the inconvenience, when you're angry at the world that it's like this? Is it possible?
It's hard, no. Sometimes you can. I think it's real obvious, but no. And that's why it really helps to have someone to talk to. A counselor's helped in the past, because to sort that out, to realize that some of those frustrations, some of the things that he said to me aren't personal. To have someone else telling us that, who's telling me that, has helped. I think it's hard to sort sometimes. I mean, no matter what, we end up taking it personally. Until one just sits the other down and says it's not personal.
There's just a hell of a lot of anxiety that goes along with it. And, you know, when you're constantly under that pressure of the anxiety and the confusion, you begin to lose touch with yourself and with each other, and with the original foundations of your marriage. You know, I suppose that a marriage goes through, over the years, goes through many different formations, and it's molded and remolded. But that takes place that's an evolution. It's a long, drawn-out affair, but when you have something like this injected into the marriage that suddenly casts you into a very volatile evolutionary phase, you gasp and you catch your breath, and the relationship is changing so quickly, and so many things are happening to the relationship so quickly that the anxiety is compounded even more. I mean, now you've got the disease to contend with, and now you've got the changes that the relationship is going with. It just, everything seems to be compounded. There seems to be a multiple factor in there, 5, 10, 15, 20, I don't know, but it just seems to get harder and harder and harder and deeper and deeper and deeper, so that you really do need some kind of third person, third party overseer kind of thing. Say, hey, look, you're doing okay. This is what you're going through, you know, and to try and open you up so that you can see what's going on around you, and to know that you're okay, and that the sick person is okay too. You've got a hell of a lot to deal with. And I think Janet and I have gotten to the point now, or we're very close to it. I don't think we're there, but we're very close to being able to maintain that healthy perspective, and to try and minimize the effects of change and anxiety and confusion. And we're able to sort things out a little bit better. No, a lot better. We're able to sort things out a lot better now than we were just 6 or 8 months ago. And there's nothing that you can't be taught. You learn it. I don't know, maybe you're going to do something about that. Maybe you are going to teach people how to better manage the effects that a life-threatening illness has. I hope so.
You know, one of the most poignant things I remember as a child, I had a very favorite great uncle who was had a large printing concern, was a very elegant man. And the last hour that I ever saw him in my life, I was home from New York City, where I was going to medical school, and he was having dinner with my aunt, wearing a white shirt as he always did, but he had lung cancer that had gone to his brain, and he had spilled food on his shirt, and my great aunt had left the room for some reason. And he looked over at me and he said, if I am going to be like this, such a burden to your aunt, I hope I die quickly. You know, and I remember, you know, just being so impressed with not knowing what to say to this man whom I loved intensely. You know, I've always has made me very aware of it. Have you felt that, Ed, that if you would be that you would want to die quickly so that Janet wouldn't be...
You can't use this against me.
Oh, yeah, it's fine.
Like this. The sweater's 21 years old.
My gosh,
Absolutely
more than
my favorite
half.
sweater.
You were a teenager when you got it?
I was,
You must have been like 16,
I was
right?
16 when I got it. Haven't changed much.
Now you can answer.
We've got the question on tape, so I guess all you need is the answer, right?
Did you ever feel that you would want to?
Yeah, yeah. You can't help feeling as though you are a burden, especially when you see the effects that frustration and anxiety have on your mate. You just can't help but feel that you are a burden. And my conscience, anyway, dictates that I try to relieve or alleviate those feelings. And in this case, the only way, really, that you can, aside from living through it for however long it takes, the only other alternative you have is to seek death or to welcome death. And I have felt like that, where I have said, look, to myself, I think I said it to Stephanie, too, if I'm not mistaken. There have just been times when for her sake, I just wish that it would be over, that either I would be cured or dead.
Did that play at all a role in your decision to discontinue treatment?
Sure it did, yeah, oh, sure. Because Janet used the phrase quality of life. I don't know how much time we have, but whatever it is, I want to feel good, and I want to be happy, and I want us to go places. We went to New York this past weekend, had a lovely time. And giving up 48 or 72 hours out of a week just in recuperating from one silly little injection wreaks havoc, plays havoc on quality of life.
Yeah, but it's not just the 72 hours a week. It was, the side effect of the low white blood count after just 3 months. He was so weak, could hardly walk up and down the stairs without catching pneumonia. It was just, couldn't go out, couldn't do anything.
Yeah.
There was no life. There was nothing.
And we've been cooped up long enough.
If indeed you were guaranteed that you were going to get this, like there are, for instance, when women have a mastectomy, is that chemotherapy is shown to be very effective as a way of controlling metastases, even though they get sick for a year. It's either every 2 weeks, usually every 6 weeks. And there's a schedule, as you might know, for different types of tumors. Would you do it then if you were guaranteed? If it said, like, if you do this, it's going to be 99% chance that you'll survive, even though you'll be sick as hell for a year? And
They'd have to tell me, they'd have to be able to tell me what my chances of survival are if I don't take it. If they were to say your chances of survival, by taking it, your chances of survival are 99%. If you don't take it, chances of survival are 50%, then I might be persuaded to take it. I am a risk taker. That's a personal comment about myself. I'm a risk taker, I'm a gambler. And I am willing to take a spin at the wheel and try my luck. And maybe that's what I'm doing here. I've certainly considered that part of my personality, of my character. So just to say that if you take it, chances are 99% that you'll be cured is not enough. I want to know what the downside is.
what would the numbers be? Really, if one had to push you, this is
50-50.
It is 50-50. If you could make it 50-50 without chemotherapy, that would be sufficient for you not to take the chemotherapy, from your perspective, rather than have the treatment.
Yeah, that's even odds.
It's even odds.
You go either way.
What would be yours, Janet? What would be your... You look surprised.
I'm shocked. I am shocked. Well, I'm shocked. They told you 99% chance it would cure you, but only 50% chance that you'll be okay without it.
No, in that
You
case,
would
I would
know
go
for
for
it.
the treatment.
That's what you just had. Isn't that what you asked?
Oh, if there were 50-50, you'd go for the treatment.
Yeah, 50-50, I'd go for the treatment.
Okay. I thought the way I understood it was, as Janet did, was that if it were 50-50...
Both sets of figures. 99%
Yeah.
chance 99% chance will cure you. If you don't take it, it's 50-50.
Yes.
I'd go for the cure in that case.
Okay.
Yeah.
Good.
I'd go for the treatment.
That's a good clarification, because I sort of read it as you did, that if it were 50-50, you'd say, I'd just take the risk if it were...
No.
You didn't like the treatment that
No,
much.
those odds I don't like. It's too sure a thing. You know, if they said that if you take the treatment it's only 50-50 that you'll be cured, you know, now I'm getting on the borderline. I'd probably opt for not taking the treatment if there were only 50-50 chance that I would be cured with the treatment.
What about 60-40?
I don't know. Yeah, it's a reasonable question, but I don't know. I'd have to think about the numbers.
I think
don't know.
a good distinction there is 60-40 if it's for this prophylactic, possible probably, I'm guessing not.
I don't know.
But
I haven't really given it any thought.
because, you know, he won't have a choice if it comes back. It will be the same treatment, but if the actual cancer's there and it's as treatment as, you know, to eradicate,
You see, that's one of the
it
things
doesn't
too that I
matter what
think-
the odds are, he'll take it.
one of the things that affected my decision is that so far the recurrence have been operable. They've been able to remove the disease surgically. And I say, hell, you know, if all I have to do is go in and get cut a little bit and stay in the hospital for a couple of weeks and they can take it out and I'm good for another 50,000 miles. Why not, you know?
I have a question. When I asked Janet, you know, whether she should be involved with the decision, how do you feel about that? You know, here you are in a marriage and you also have a son. Do you think that in any way the decision around whether you want to be treated or not should involve your wife or your son or your parents? Or should it really just be you? How do you feel about having the illness?
Do I feel that Janet should be involved in the
Janet
decision?
should be involved, or your son, or your
My
parents?
son is too young, so. My parents, no, they shouldn't be involved in the decision, just my wife.
And you think she should be? Like if Janet said to you, if you said you didn't want to have the treatment and Janet said, I'd really like you to have the treatment, would you be angry at her if she said that? Because you'd have to
No, I might
do
be a
that.
little- I might be a little confused. Yeah, and her, it's not, it isn't so much that her opinion is going to, her opinion is definitely not going to be the sole criteria by which I make my decision. The decision ultimately rests with me, solely with me. I want to hear what she has to say, though, because she might have a thought, a perspective on it that I haven't taken into consideration that will help me in reaching a decision. She doesn't make the decision. In this case, she didn't make the decision for me, nor would I have allowed her to make the decision for me. That had to come from me. But when she said, honey, if you don't want to go through with it, if you don't want to go have any more treatments anymore, I understand. That helped me. That put me at ease. But it wasn't the reason why I ultimately decided not to take the treatment anymore.
Janet, now if he involved you with the decision, do you think you would be less upset and angry at him when he might get acid with the effects of the treatment? You know, here he gets nauseous or vomiting or loses his hair or has diarrhea, you know, these awful things that one has as part of the treatment. If you were involved in saying take that treatment, do you think that you could take more of that even though he may, might be, you're a human being. How much can you be battered? It's like the story of
Should I be
Job.
more patient because I asked him and pushed him to do it. I have ownership in it, in the decision.
So you'd feel you had ownership then, and therefore some of the consequences, which would be symptoms in which even you might feel, gosh, Ed, why are you battering me around this thing? I'm here, and it's making it hard for even to get on. But you'd say if you played a role in that decision, it would be easier.
It would be, because if I started to do that, he'd say, you were the one that wanted me to take this. And I'd say, you're right. So, yeah.
Although sometimes, even though we have ownership, if we are confronted with a set of consequences that we don't like, sometimes we manage to rationalize our original decision, say, no, it was a poor one, and I've changed my mind now, after the fact kind of thing. Maybe that's the way, one deals with unkind or unnice consequences. I can't think of an example, but I've done it, where I've said at the outset of something, we will do this, this, and this. And as a result of those activities, we've had to suffer certain consequences, or I've had to suffer certain consequences, and I didn't like them, so I said, well, that original decision was wrong. It should have been this, this, and this. So let's, ownership, screw the ownership part of it. I don't like what's happened here. So let me rationalize my way out of it. I think we, as humans, we do that. Yeah, if it gets too tough for us.
How have you done since you stopped treatment? Are you gaining weight or?
No, I'm just feeling better. When I made that decision to stop treatment, boy, was it a relief. Knowing that I don't have to go there every week and get sick.
How long ago was that?
When did we make the
2
decision?
weeks.
It's only been about 2 weeks, yeah. It was just such a free feeling to know that I don't have to go through that anymore. And, I was asked today by my primary nurse, she said, will you feel any regrets if this decision winds up to be wrong? Well, first of all, I question whether or not anyone would be able to prove that it was a wrong decision. But even if they were, I would not have any regrets, because I am buying myself some quality time here, and that's what I'm primarily concerned. And I'm betting on the come. I'm betting that if it does recur, if the disease does recur, that they'll be able to just make a little hole from there and dig it out and start all over again.
How has your weight been?
Constant. I've dropped about 13 pounds over a period of 4, 5, 6 months, and haven't gained it back. I'm holding steady at 120. But I feel, I'm feeling better about myself, and every day I feel a little bit better. I still tire easily. Going back to work January 3rd, by the way. And looking forward to that, kind of sitting on a fence about going back to work. I want to go back to work because it's going to put me back in touch with people. I'll be productive. I'll be doing something that gives me an outside interest, something other than working around the house. But on the other side of the coin, because I don't know what my condition will be 6 months from now. It could be bad, and I could be in the middle of a major project and wind up putting my employer in a bind. And that kind of bothers me. But like a friend said to me tonight, when we had dinner with him, she said, you can't think about that. You can't hold yourself responsible for that. And that's true. It's an easy thing to say, a difficult thing to do, but ultimately I've got to get there. Right? I can't be worried about that. I've just got to go on and work and have fun and enjoy what I'm doing while I'm doing it. And if we have to suffer some consequences, we have to suffer some consequences. So, and certainly being off the chemotherapy will make my transition back to work much easier. I would have had to have had the chemotherapy on Fridays, which would have probably made my weekends miserable, and then you go right back to work again on Monday. So being off the chemotherapy will help my mental attitude and adjusting back into work life.
I can't help but asking you one of the obvious questions, since Ed and I were talking about Christmas before, and he likes to always have Christmas trees. You said you even had them when you lived alone. How is this Christmas, feeling it's...
Well, the Lord does work in mysterious ways. I mean, there's miracles do happen. Considering he's been just so ill and so bad off for about 4 months, constant pain, and suddenly in the last 2 weeks, 2.5 weeks before Christmas, and he started it all started finally coming together, the pain working itself out. And it's just been wonderful. It's just been, the timing just couldn't be better. At least we'll have a really, really terrific Christmas.
There's some wood.
It's hard to find in a modern place.
Oh, just gotten, even just 2 weeks ago, I've really gotten to where I prepare myself for disappointment and nothing happening. And then I think I still hope that it'll turn out, something nice will happen and I'll be surprised. But I've really gotten to where I don't mean to be pessimistic, but I've just gotten to where I just plan on nothing good happening. And I just mean on a day-to-day basis, little things with that. And so I had completely prepared myself for not having any kind of a Christmas, no tree, no decorations, no getting into the spirit. And then he started feeling good, and he got up one day after having not even been driving a car for 5 months, got in his truck that I didn't even think would ever start again, and went out and bought a Christmas tree and brought it home and got all the lights and just decorated and just had a ball. And it's been out Christmas shopping, and we just have 30,000 gifts under the tree, and it's just going to be wonderful.
Gotta be a ball.
What does Christmas mean to you?
Oh, love and family and presents. Hundreds of presents.
There's a great Santa Claus
Oh,
coming.
it's true. He wants, I mean, if you asked him if he would rather have one $5,000 gift or $5,001 gift, he'll take the $5,001 and just take 20 minutes with each one to open it so that it lasts all day sitting around that tree.
Yeah, we'll get up Christmas morning and have some coffee and some sweet rolls or something, and just kind of leisurely sit there and look at the tree with the lights on. Just build up the anticipation.
Light a fire.
Just tear the paper apart. Love it. Absolutely love it. It's just the best time of the year for family and for love. And
Do you feel let down after Christmas?
I haven't ever in the past.
no, I don't feel let down because I immediately start looking forward to the next one.
Well, we've always had we have had New Year's parties after that. And we've usually just been in such a state of change. Things are happening constantly that we just don't. I guess Christmas night it's a letdown. All of a sudden there were so many presents under that tree and it's bare. That's a little depressing.
Yeah, you wish you could start it all over.
Yeah.
Janet, where have you sought support around this? You know, when you were really feeling like almost telling Ed to go home to his parents, how'd you handle it?
Let me correct you. She wasn't almost feeling like Ed should go home to his parents. She was adamantly feeling that Ed should
Packing you up.
She handed me a peanut butter and jelly sandwich and said, "On your way, boy."
Okay, when you were ready to walk out, how did, I mean, did you have anyone you could talk to other than your counselor? Did you?
Yeah, I have one really close friend, and which is just really uncanny timing. Her husband is younger than Ed, and has had a very serious heart condition that came on very suddenly. He was in the hospital. She lives in L.A., but we talk constantly, and he was in the hospital at the exact same time, only he was in for longer, 3 months, and he's still not back to work, and it turns out he's going to have some heart surgery.
How old is he?
In March.
27.
27.
Very young.
It's incredible.
They think it was an infection in the heart valves or something that started all this, but we've gone through the exact same thing at the exact same time. It's just uncanny, where she and I are both working, and suddenly they're at home all day.
New jobs.
Yeah, she and I are both in new jobs, do the exact same kind of work, and so we share everything in our jobs. And then going through the same things of, I would call her and say, you know, I'm really going nuts. This has been fine for a while, but I'm really being bothered by this little house husband business.
Yes.
And she's saying, me too. It was kind of funny at first and cute. I'd come home from work and he's there, but it's not so fun anymore. And different little things. That has just been really remarkable. and
That's good. You know, one of the things that, you know, is hard sometimes for parents to really realize, that most parents feel like killing their kids sometimes, and it's not just a fantasy. You know, this is driving me crazy. I wish the kids, I want to bail out and, you know, enter the counterculture or something, and in that it doesn't mean anything bad. It's just a real feeling of being so overwhelmed with something that a young person, we met, which is not infrequent. The first time I'll meet 2 hours, because it's easier to take a long history from someone and talk about parents and sexuality and drugs and friends and work and all that stuff. But you know, we did it one more time, and, you know, and I said, you know, it really is, it's not as, you know, one gets into a lot of very immediate things, and there's been a lot of action going on in these 40 minutes.
I was wondering about, and it might be very useful for other people, if you could describe a little bit about the experience you had with the pain medication. That as just a separate event.
Experience with the pain medication.
Yeah.
I think I know what you mean, but I don't. Yeah.
Just how you got involved in taking pain medication, how it helped, what it felt like, what if any negotiations with the staff was there about it? Was there a component of stress in terms of your experience of pain? Just anything that comes to mind about.
Management of pain, management of pain is a big conflicted area because people will often think that patients, family members and staff, physicians and nurses, feel that patients want too much pain medication. Patients, on the other hand, will say, I have the pain. And a difficult thing for everyone to realize is whether pain is, quote, all in one's head or all in one's body. Pain is pain. It's the same. And did you have this experience? Did you have any difficulty with...
I could give you probably a couple hours on pain. Well, I'll start at the beginning. I've always fancied myself as having a high tolerance. I could absorb a lot of pain. So what do you call that, a high threshold?
Yes, high threshold.
I'm the type of person that can go into a dentist and not have any Novocaine. Janet will vouch for that. What has happened, to kind of capsulize this, what has happened is my tolerance for pain has diminished. I don't think I can tolerate as much pain now as I could a year ago. The question of, in fact, when this whole thing started, the question of pain medication, I was adamantly opposed to pain medication for a couple of reasons. Number one, I didn't want to build up any dependencies. And, you know, I've been taking some heavy-duty stuff here, methadone and Dilaudid, which you can sell on the street for $10 a pop. You know, I could be a very wealthy man right now. So the question of pain medication, early on, I simply would not take it because I didn't want to get addicted. And secondly, pain is to me, pain is a normal biological function. It is your body telling you that it is hurting. If you try to mask that, then what you're doing is cutting off the communication between your mind and your body, and that's not fair. That's not right. That's not normal. So we started with that. Then I went into the hospital for the first surgery and got introduced to Demerol. And Demerol gives you a real nice buzz about 7 to 12 minutes after the injection. Gives you a very nice buzz, but it also relieves the pain. And with that first piece of surgery, I suddenly realized that I didn't have to live with pain. And in fact, the caretakers supported that. They said, look, you don't have to live with this pain. Don't be a fool. Take the Demerol. I took the Demerol. Now, whether the pain has gotten worse as time has gone on, or whether my tolerance for pain has weakened, is a subject of debate. I would concede that yes, my tolerance for pain has gotten less, which then means that my need for pain medication has become more important to me. But I have not become addicted to anything. I can say that absolutely categorically because I can cut it off. There have been times when I will experiment with myself and be in pain, but not take the pain medication because I want to be in touch with myself. I want my body to tell me what's going on. But then there are other times when I will rationalize and say, look, I don't have to live with this. I've got 100 pills sitting in there, and I can take them. And I try to stick to the dosages. In fact, I stick to what the prescription says. 1 capsule every 4 hours, alternating 2 every other 4 hours, or something like that.
I think one real key thing there is going back to where he said that he felt, you know, he didn't want to get addicted to anything and, you know, take too much pain medication will reduce his tolerance, whatever. That's where we got some help from my counselor, in that she said he doesn't have to be in pain. And the doctor is not at fault, but never really addressed this issue. And he gave, the very first time, you know, he was really having pain with the second tumor, he gave him Dilaudid, and this, back to the directions business. The directions said, take as needed. Well, so Ed's thinking, I just bear this until it's so bad, then I take it. Well, then this is where we got finally some good advice that he doesn't need to be in pain. In fact, you shouldn't wait till it's so bad because then it's hit its peak of pain. You should be on this continuously every 3 to 4 hours, not just because that as needed was very misleading. He really needed to have it in his system at a certain level, and it was just like night and day when we learned about that. And also what had been happening, he waited till the pain, first of all, was too high at its peak, so it really didn't help much. Then he'd take probably too much. It would say 1 or 2 tablets a week. Go ahead and take 2 because it wasn't working.
All these years we blew a fuse.
No,
I think it's the ball, right?
Good question. The medication.
You know what? It really isn't it. One of the things that Mickey gave me was some articles.
Fuse. No, we blew the light. Is the deck still operating?
Yeah. Go ahead.
Oh, and gave me a couple of articles explaining this whole thing too. In fact, right this morning, she's got a few days left. He's really bad. But just even a couple months ago, it was really getting bad, and he was saying he's in a lot of pain. And I said, are they doing? What are they doing for his pain? So I brought him this article. I said, this might be interesting. He said, turned their world around too. His father was suffering so much, kind of needlessly and whatever. So he, at least for the last month, has not been in any pain, and it's going now easy. So I think that, just the fact that happened to us, then I shared it with him and it happened to them, I think that must be real key and it must be happening a lot.
Oh, it's very common. One of the simple things I think, Ed, that you and Janet both have addressed is that there is the schedule.
That one went too.
That one blew too.
Are they connected?
That many times people would be giving like every 4 hours things that need to be given every 3 hours. In psychiatry, there's a great emphasis on our department in a general hospital of teaching people, excuse me, how to give pain medication. Because not only is it the correct dosage, it's the correct schedule. And things like Demerol, if it's given every 4 hours, that it can dip down in certain ways. And for some people, it's for all practical purposes non-effective. And then people get into these things because pain involves control and counter-control. And unless somebody's really experienced pain, it's like I have had short-term back pain, but I know friends of mine who've had long-term. And if you have a short-term, whether it's psychological or physical, what does that mean? How are you going to know? Who will ever really know the answer to that question? But one can answer the question of how pain medications do work. And when patients will report, like at the end of a certain time period or with a certain dosage, that they're in pain, it may be because the pain medication is not working. One of the things is actually we frequently give, which enhances the effectiveness of pain medications, giving it with antidepressants. The drug Elavil is sometimes used in the management of people with chronic pain because it makes pain medications actually work better. It's not
They tried morphine on me. Morphine has absolutely no effect at all. There's nothing.
Well, back to one of the things that was concerning Ned is, like I said, he was waiting too long to take the pain medication. But then he'd take too much and he'd get completely out of it. Not sick, necessarily. Not with a lot of he was just getting so spaced, and he hated that feeling. And she said, to have someone just say, then you need to work with the dosage. It's not steadfast, only this much at this many times. Take a little, maybe take a half more here, a half, and play around with it till it should, and if this medication doesn't work out, there are others. And you should be able to find that happy medium of not being completely spaced out or feeling nauseous. Nausea is easy to deal with, the nausea pills, but not feeling spacey and yet controlling the pain.
How did you feel, Janet? Because one of the things that is, it's both with caregivers and family members, they sometimes feel that a patient is asking for too much pain medication. It's sort of like if anyone has had any experiences, and you have like with alcoholism or with people who smoke too much, which you're very sensitive to, it's sort of like, why are you ruining yourself sort of thing. Did you have any of those feelings?
Yeah, I did. This is a real sensitive issue kind of between us, but once after his operation, when supposedly he was supposed to be getting better, he was still having a lot of pain, and the doctors couldn't figure out why. There was nothing there. So we're getting into this
Yes.
psychological thing. But they were also saying what can very easily happen is well, there was pain, first of all, and it turns out to be just a lot of gas trapping. And yes, I was thinking you're taking too much pain medication. Another thing that seemed to be happening, I felt, is he was getting a real dependence on wanting injections of Dilaudid. He even at one point got to
Injections of Dilaudid.
I'm sorry, injections of Demerol. Got to the point where he wanted to go in the hospital just so he could have injections of Demerol to do the pain. And that bothered me because he wanted someone else to be in control. He wanted someone else to take care of him, to administer. And also it happened because it took faster effect. I just felt like his tolerance was going down. He wanted immediate relief and wasn't willing to work at getting the pain regimen.
Did you feel...
I think you got your chronology a little out of whack there.
What are you talking about?
Well, what you're talking about is the incident when I met Wyman on a Friday morning. And I didn't just want Demerol, I just wanted somebody to take care of me. It
Yes,
wasn't just
I know,
Demerol
I know.
because I wasn't on the methadone yet. But once he gave me the methadone, then it was... The Dilaudid I had built up a tolerance to Dilaudid to the point where I was taking a lot of it when I would take it to get any benefit from it at all. So the only thing left that I knew of at that time was Demerol. And then I was introduced to methadone, which is a very strong narcotic, and that methadone is what I use now to control my pain.
You got into a good point, though, when you said that when he asked for the injections, it was giving somebody else the control to take care of him. Was that an issue? Did you feel that as a conscious issue? Because that is something, that somehow it was taken out of your hands and he was going in to ask someone else to control, and there's this tension between the two of you.
Very conscious issue, a fear that he was becoming dependent on. This is a very interesting thing that happened, and I have a feeling it happens probably to other people too. You know, when this all started out with his sickness, I was so overprotective and constantly wanting to take care of him. And I would say, Ed, don't push yourself, don't do that, let me get that completely taken care of him. Well, as time progressed, just what happened, it kind of started to go the other way. He wouldn't push himself at all, and it was, okay, take care of me. You're telling me not to do it. And this was all unspoken and all subconscious and unconscious that was happening. And then all of a sudden, before we knew it, after 8 months, we were at the point where Ed was pretty dependent on the caretakers, on me, and then I realized a lot of it probably was my fault for pushing it on him. And when it all came out, as we started a discussion on it with the doctor and with myself, and at one point, we just had a discussion about this, the possibility of becoming too dependent. And then just a few hours later, he was doing something, and I said, well, stop doing that. Why are you pushing yourself? What, do you want to be sick?
Yes.
And he said, Janet, stop these conflicting signals. I mean, 1 minute you're telling me I'm not taking responsibility, I'm becoming too dependent, and then when I'm trying to do something for myself, I'm pushing myself. Don't push yourself. Let me do it. Let me take care of it. And it just, I realized I was doing this.
This is a good point. Do the two of you find yourself sort of fighting between an independent posture? Do you, like Ed, do you see yourself on one hand wanting to be taken care of, passive, on the other hand wanting to be independent and taking control yourself like you did with stopping treatment?
Sure. Yeah, and as, you know, from the patient's perspective, there is a lot of conflict. There are conflicting messages constantly being given out. The caregivers want to take care of you, but they want to do it on their own terms. Like you said, one of the issues here is the caregivers feel as though the patient wants too much medication, and yet the patient is the one who is really experiencing the pain. So either you want to take care of me or you don't want to take care of me. If you want to take care of me, then let me tell you how bad the pain is and what will help alleviate the pain. Personally, I know that morphine has no benefit at all for me. Dilaudid I have built up a tolerance to. The only things that are of any benefit to me now are Demerol through injection and methadone. Coincidentally, we were down in Pennsylvania, and I started to pass a kidney stone, and I checked into Bryn Mawr Hospital, went into the emergency room, and I said, I'm a cancer patient. These are the things that work for me. These are the things that don't work for me. They were very attentive. listened to me, gave me exactly what I needed, and I was out of there the next day. I think in many cases the patient really does know what is best for the patient. And I think that the caregivers ought to pay a little more attention. Because there is no standard. You cannot say, I mean, morphine works wonders for some people. It doesn't do anything for me. But if you assume that all people are going to respond favorably to morphine, you're making a big mistake. The caretaker is, okay, or the caregiver. Another conflict that I often feel is the one that is the one that Janet brought up, and that is, you're telling me to take more responsibility, but what your actions are indicating is that you want me to rely on you, and I can't, you know, I can't go both ways. I mean, I'm either gonna take responsibility for myself, or I'm gonna rely on you. Or if you want me to do both, to what degree do you want me to do both? You know, define those parameters for me. And that is true also of the hospital, because the nurses would say, "Damn it, Ed, you don't have to be in pain, take the Demerol." But then when I wanted the Demerol 30 minutes before I was due for it, I'd say, "Oh, you can't have it yet, Ed." You know,
And what was the time frame for you getting Demerol?
4 hours, every 4 hours. But at the third hour, I would begin to feel the pain again. So I would lie there and suffer in pain. But they would tell me, "Ed, you don't have to suffer. You don't have to be in pain. But you got to wait the 4 hours." But I'm hurting at 3.
3 hours is the usual thing.
And that's one of the things too, my counselor said, then that's, the nurse has her orders, and that's true. She can't, what you need to do at that point is say, "I want you to call my doctor and ask him to change that prescription to make it every 3 hours." You know, patients don't know they can have some control, or at least call my doctor and ask him if you can make it every 3 hours instead of 4. Don't just be at the, you know, at the
And I'll tell you,
hands of the
I got to
nurse.
say this. One thing that has really bugged me is that whenever, or frequently, when I have behaved in what Janet feels an inappropriate pattern, we get into this thing of my head. You know, I messed up in my head and I need counseling. And I got to tell you something, it begins to wear kind of thin, because I feel that I'm very much in touch with myself. And I know what's going on. Now, I'm the one who's experiencing the pain, and I'm the one who's doing the experiencing. You're the one that's, you know, she's along for the ride, so to speak. Although it's a very bumpy ride, I admit that. But I sort of resent the implication that everything can be controlled by the mind. Now, if you want to get into biofeedback, fine, let's talk about biofeedback. But I'm not into biofeedback. The only thing I can rely on are my instincts and what my body is communicating to me. And if every time I'm going to get put down because, quote, according to somebody else, I'm losing control, mental control, I'm sorry, I don't buy that. And I think that the caregivers or caretakers, what are you calling them, caretakers or caregivers?
Caregivers.
The caregivers, or caretakers or something. But I think the caregivers play those mind games a little bit too. You know?
Well, you know, there's an old saying that I always think is so helpful around that, is the heart has ways the mind does not know. And that, you know, that one thinks that there is rational approaches, and that no matter how bright or clever, you know, if you were the world's expert on pain, when you would suffer pain, it would be a unique case of one person suffering pain, in which all that knowledge base is not going to be as relevant as to how it feels at that moment.
There was one other thing that happened with this pain medication that I think is really interesting that's been kind of happening to Ed. When you're on, and this is really a trap that I guess you can get into when you're on a narcotic, on heavy pain narcotics. It's this business. When he got out of the hospital and he was still on it, he started having, he had pain and he was taking narcotics for pain. And then the pain seemed to start to go away, but he was, one thing I guess that really follows those narcotics is constipation. And
Yes.
he started getting pains, and it turns out they were constipation pains. Well, he continued taking pain medication for those pains. Vicious cycle, and I guess it's a real common trap to get into. But this wasn't addressed until we really just had to grill the doctor about, you know, what is happening here and how do we get out of this and what's going on.